Okay, in this video, we're going to talk about the medications that are used to treat diabetes. We're going to start off by taking a look at synthetic insulin or synthetic human insulin, as well as some oral medications that are used to treat diabetes. Now, I'm going to start off with a few terms that'll help you understand insulin and how it's used. But also these terms are terms that are very much used by providers when they're talking to patients about insulin use and while they are training them to use insulin at home. And so these terms are terms that you should know how to say in your language of service. Okay, so the first term here is onset. And what is meant by onset in the context of explaining how insulin works is when the insulin kicks in. So when the insulin starts working. Peak is when the insulin is working the hardest, fighting hyperglycemia with the strongest ability. And then duration is basically how long the insulin stays in the body, how long it's working in the body. Now let's take a look at vocabulary related to the types of insulin that are used to treat diabetes. I want to say first that I'm giving this explanation of how insulin works, not because you will be responsible for knowing which types of insulin a patient should take. You are not responsible for knowing when to recommend what. Of course not. But I'm sharing these explanations so that you can become familiar with the vocabulary involved in the treatment of diabetes that involves insulin, and so that you can learn terms used to educate patients and train them to self-administer insulin. This information is so important because patients are being asked to inject insulin, which needs to be measured appropriately, because when it is not, it can cause dangerous and even life-threatening consequences. If a patient, for example, does not inject enough insulin, whether it be because they skipped a dose or didn't use the correct amount, their blood glucose level can rise to a level that is too high, and this is called hyperglycemia. Hyperglycemia can cause symptoms like nausea and vomiting, shortness of breath, dry mouth, weakness, confusion, abdominal pain, but also coma. Now, on the other hand, without sufficient insulin, we know that the body cannot use sugar or glucose for energy, and so it will start burning fat and muscle. And that process produces ketones, which end up in the blood and urine, and this is called ketoacidosis. Ketones are acids, and they are toxic, and they can cause damage in the body. So if a patient injects too much insulin, whether it be they injected insulin without having a meal, and now the body has too much insulin that it doesn't need, or because they injected the wrong dose, their blood sugar can drop to a level that is too low, and that's called hypoglycemia. Early signs include sweating, feeling tired, dizziness, tingling lips, feeling shaky or trembling, palpitations, which we learned means a fast or pounding heartbeat, and the infamous hangry, so becoming easily irritated, tearful, anxious, or moody. If a low blood sugar level is not treated, more serious symptoms can occur, like blurred vision, confusion, or difficulty concentrating, unusual behavior, slurred speech, clumsiness like being drunk, seizures, collapsing, or passing out. Okay, so now we can start talking about insulin. Just quick facts about insulin. Insulin was discovered in 1921. Before that, people with diabetes didn't really live very long, and treatment just consisted in limiting the amount of carbohydrates a patient ate. This limitation in carbohydrates resulted in super harsh diets. Some doctors prescribed as little as 450 calories a day. And so even with these restrictions, patients didn't live very long, sometimes either because of how harsh these diets were, they would lead to patients actually starving, but also because it wasn't sufficient to treat diabetes. Insulin is a hormone and is normally produced by the body. Insulin used to treat diabetes is called synthetic human insulin, which means that it was developed and produced in a lab. Okay, let's take a look at the various types of insulin now. We'll start with rapid-acting insulins. Rapid-acting insulins are also called fast-acting insulin. The most common ones that you'll see are the Lispro insulin. Brand names are Humalog and Admelog. Another type of rapid-acting insulin is Aspart insulin, and the brand names include Novolog and Fiasp. Okay, so the onset of rapid-acting insulin is within 30 minutes. This means that for all of the rapid-acting insulin, they are going to start working in the body no later than 30 minutes. Some start as soon as 15 minutes, but all of them start working within 30 minutes from the time it was injected. This type of insulin is going to be peaking, which means working at its most powerful rate within 2 hours. Then within about 4 to 5 hours, it's going to be out of the patient's system. So the duration for rapid-acting insulin is 4 to 5 hours. Insulin, as I mentioned, is injected. Now, there is one type of rapid-acting insulin that is inhaled, and it is called Afrezza. So this insulin is not injected, it's actually inhaled through the mouth, and you can see here that it comes in these small cartridges, which a person can put to their mouth, push the button, and then inhale. Okay, the next type is going to be short-acting insulin, and it's also referred to as regular insulin. And this part I really want you to pay attention to because this is a very common error for the public in general, but also for interpreters if they don't understand that there is a difference between short-acting and fast-acting. So as you learn this vocabulary, it is very important that you understand that fast-acting is not the same as short-acting. Terminology-wise, sometimes people confuse these and commit errors in interpreting. So again, it's one of the reasons why I am taking the time to explain how they work, so that you understand the importance of being accurate and you learn the correct way to interpret these two very different terms. The onset for the short-acting, also called regular insulin, is within 30 minutes to an hour. Short-acting insulin takes longer to peak. They peak after 3 hours of injection compared to the fast-acting or rapid-acting. And then within about 8 hours, these insulins are out of the patient's system. So they also stay in the system longer. Examples of short-acting insulin include Human Regular. Brands are Humulin R, Novolin R, Velosulin R. And it's very important that if the provider says R, that you also say R and you don't try to shorten it and leave the R out, because that R makes a big difference in identifying the medication, whether it is regular insulin, which means it's short-acting, or it's a different type. Now with Velosulin R, sometimes this is simply referred to as Velo. If you're interpreting and it's not clear to you what is meant by Velo, you should ask for clarification, of course. If the patient shows confusion, you should try to match tone to communicate their confusion to the provider. And if you think, keywords here being you think, that you clearly interpreted what was said by the patient, but it was not perceived by the provider, then you can intervene and say, the interpreter would like to point out that there may be some confusion with the term Velo. Okay, let's look at more vocabulary regarding the types of insulin used to treat diabetes. And let's take a look at intermediate acting, which is also sometimes referred to as cloudy insulin. You can see there's a huge difference when you go from short acting to intermediate acting, especially in the duration of these. Onset is between 1 to 2 hours. So that means it's going to start working after 2 hours of injection. Depending on the one used, it can take between 4 to 12 hours to peak, and the duration is between 12 to 18 hours, again, depending on which one the patient uses. Examples of this include Humulin N and Novolin N, which is commonly called insulin NPH. Now, you heard me mention that if there's an R or an N behind them, that you should mention that and not leave it out. Now, here's a really good example of how things can become confusing. You see that Novolin R is a type of short-acting regular insulin, whereas Novolin N is an intermediate-acting. So you must be careful, again, be sure, because that can make a huge difference between interpreting accurately and not. Now, for this reason, Novolin N is commonly called insulin NPH. And so when you are interpreting and the provider says NPH, then if you share a common alphabet with the English language, you can say NPH. So for example, in Spanish, NPH. If you use a different alphabet in your language of service, for example, the Cyrillic alphabet, then you are going to say this as commonly known as NPH. So you're going to say commonly known in your language of service and then leave the letters NPH in English. Okay, so you heard me say that this type of insulin can sometimes be referred to as cloudy insulin. And I'd like to mention 2 things about this. First, you must know how to say cloudy. This term is used a lot when a person is being taught how to use insulin, so you will definitely be interpreting this term. You should know what term is used to describe a liquid as cloudy in your language of service. So in these pictures, you should be able to note what I mean by cloudy and choose the appropriate word for describing a cloudy liquid in your language of service. Second, intermediate insulins contain added substances known as buffers, and this is what makes them work a longer period of time, but they also make them look cloudy. That's why it is very often referred to as cloudy insulin. This is also very helpful because it is easier to identify and it helps a patient remember it rather than remembering the names of the different insulins. Some instructions you may hear from a provider and you'll have to interpret would be something like,
when cloudy insulin sits for even just a few minutes, it settles to the bottom of the vial. That means that before you use it, you will need to mix it. It's very important that you don't shake the bottle to mix it. What you will need to do is first pick up the bottle and turn it upside down. Then roll the bottle gently between your hands to mix the insulin, like this.
A word that you heard in this example that is very important for you to know how to say and to understand is the term settle. And this is what we mean by that term in this context. You can see here that you have a solution of water and sugar. And so if you let it sit for a while without stirring it or shaking it, the sugar is going to separate from the water and settle at the bottom. Okay, so it is very common that a person will need to inject 2 types of insulin. Another sentence that is very common for you to interpret is,
you're going to inject 10 units of clear insulin and 30 units of cloudy insulin.
And here's another example of how that same information can be delivered to the patient. And I hope that as I have been giving you these short examples, you're giving them a try. It's a good way to start using some of the terms that we covered here in this presentation.
You will have to combine 10 units of clear insulin with 30 units of NPH, which is the cloudy insulin.
Another term you should know how to say is the term premixed. And this is a term that you will come across to describe not a type of insulin, but sometimes when patients are directed to take 2 types of insulin, they may be able to receive it in a pre-mixed vial. And so usually pre-mixed insulin vials are going to be a mixture of rapid and intermediate acting insulin. So a provider might explain to a patient that the insulin that they are going to be injecting will be, for example, 70% NPH and 30% regular. Another way that providers communicate this is by telling the patient that they are going to be using a 70-30 mixture. And so a 70-30 mixture, that phrase, if it doesn't really flow very well in your language of service, you will have to rephrase that to mean the exact same thing. So you could say something like, you will inject a pre-mixed insulin that is 70% one type of insulin together with 30% of another kind of insulin. And in this slide, you can see the common types of premixes. And again, you don't have to remember this, just be familiar with the concept and the terms used to explain this concept to patients. All right, and let's move on to talk about the last type of insulin that we are going to go over in this presentation, and that's going to be the long-acting insulin. Long-acting insulin starts working after 1 to 2 hours, but it doesn't peak until about 18 hours after injection. And the duration, or the time that it stays in the body, is 24 hours. This type of insulin is usually injected close to bedtime to protect the person overnight from hyperglycemia. Sometimes this type of insulin is referred to as overnight insulin. So in this case, when this concept is being explained to a patient, some of the terms that you will need to know how to say: at bedtime or just before bedtime, as well as overnight insulin. The most common one I have seen used is called Lantus. That's the name brand. Detamir is another type, and the name brand is Levemir. And Duglotec insulin is another type of this kind of insulin, and the name brand most commonly used is Tresiba. All right, now we're going to take a look at oral medications that are anti-hyperglycemics. So what are anti-hyperglycemics? Well, we can break down the word to figure out what it means. So we know that anti means against, hyper means too much or elevated, and glycemic is the presence of glucose in the blood. So what this means is that anti-hyperglycemics are used to improve blood sugar control. The most common one you will run into is Metformin, and Metformin is used only to treat type 2 diabetes or gestational diabetes, but not type 1 diabetes. And the reason for that is because of the job that Metformin does. Metformin tells the liver not to release glucose, but it also tells the body to use the sugar in the blood so it doesn't remain in the blood causing high levels of sugar. It does this by stimulating the use of insulin. Now, in type 1, we said that the person's pancreas is not producing insulin, and so metformin wouldn't do one of the jobs it is meant to do, which is to tell the body to use insulin because there is no insulin. Okay, so metformin is a biguanide, but you don't need to know the term biguanide. Metformin is the only medication of its kind, and so it's usually referred to by metformin because it's easier to say. What you should know is that metformin is sometimes used alone or in combination with insulin, but sometimes if the patient doesn't need to inject insulin, if their diabetes can be treated with oral medications only, metformin is then prescribed alone or in combination with another oral medication that's called a glipizide. So let's take a look first at the name brands for metformin, and those are going to include Fortimet, Glucophage, Glucophage XR, Glumetza, and Riomet. Glipizide, which is that other medication that sometimes is prescribed along with metformin. Glipizide name brands include Glucotrol and Glucotrol XL. Now, there is a tablet available that already combines glipizide with metformin, and that medication is called Metaglib. And so that's a glipizide and metformin combination. Okay, the last thing we're going to talk about in this presentation is going to be some vocabulary related to dosing. So the terms that are used to communicate to the patient their dosage. So it's going to be important here is that you are familiar with the terms used in the metric system. So of course, Americans use a customary system of units in commercial activities, as well as for personal and social use. So for example, when we go to buy a pound of ham at the deli, or when we are weighing ourselves, we weigh ourselves in pounds. When we are measuring ourselves, we measure ourselves in feet. But in science and in medicine, metric units are used. And so when it comes to healthcare interpreting, we don't have to know how to convert. That is something that is outside of our scope. But we do need to become familiar with the terminology used so that we're able to interpret it. And so previously, when we've talked about medication, we've used the term milligrams. The definition of milligram is 1,000th of a gram. Milli means 1,000. And the reason we've used milligrams before is because we have mostly been talking about tablets, pills, things like that. And grams are used to measure weight or mass. So we're talking about things that are solids. Milliliters, on the other hand, are used to measure volume. And so we're talking about liquids. A milliliter is used as a unit of capacity that is equal to 1,000th of a liter. Because insulin is a liquid, it is usually measured in milliliters. You'll need to know how to say the terms units, milligram, milliliters, and strength, so that if a patient is given this explanation regarding their insulin, you know how to interpret it.